Hello, everyone, and thank you for joining me today. This is MedSearch 2, Chapter 49, which is the introduction to the endocrine system. So, endocrine glands secrete hormones directly into our bloodstream, and this helps to maintain our homeostasis, meaning that it helps regulate our metabolism, growth, fluid, electrolyte balances, our reproductive process, as well as our sleep and wake cycles. Now, an endocrine gland differs from an exocrine gland. An exocrine gland secretes via duct, such as your sweat glands. So that is an exocrine gland. Well, an endocrine gland that secretes directly into the bloodstream. Now, chapter 49, the following glands and the hormones they secrete are what we're going to be focusing on. So, we're going to be talking about the pituitary gland, the hypothalamus, the thyroid, the pineal gland, adrenal gland, pancreas, and the gonads. Now, there are some organs that do release some hormones, and they play a vital role as well. Now, the organs that release these hormones are the heart, the kidney, the placenta, skin, and the GI system. So let's start with the heart. The heart excretes a hormone known as atrial natriuretic peptide. This hormone helps to regulate the blood volume by promoting urinary excretion of sodium. The kidneys excrete renin and erythropoietin. Renin initiates the production of angiotensin and aldosterone to increase the blood pressure and maintain blood volume. Now, the erythropoietin that promotes that red blood cell production. The placenta secretes estrogen and progesterone, as well as CRH hormones, which are your corticotropin releasing hormones. The skin, now when it's exposed to sunlight, the epidermal skin cells form a precursor of vitamin D. The liver continues to convert that, and the kidneys complete the activation process. So that is the role that the skin plays in the releasing of those hormones. Now, our GI system, we have gastrin. Now, gastrin is released within the stomach, and this increases the production of hydrochloric acid. We also have hormones that are secreted in the small intestines, and that contraction of the gallbladder to release dietary fat as it's ingest. Let me say that again, get it a little bit clearer. So there are cholecystokine released from cells in the small intestine, and this stimulates contraction of the gallbladder to release bile when dietary fat is ingested. Hopefully that makes a little bit more sense this time. But those are the organ releasing hormones, and we're really not going to focus on that throughout chapter 49. We're going to focus mainly on these endocrine glands, but do know that there are some organs that do release some hormones. Now, with that being said, remember we have to do an assessment whenever you are assessing a client for an endocrine disorder. Remember, this is a focused assessment. Yes, you're going to do a total head to toe assessment, but remember, you're going to be focused on more of the abnormalities that you're going to see with endocrine disorders. And so that's what you're going to be focusing on. It's going to be a focused assessment. So make sure that you get a good family history. History of their allergies, and of course, what's their current symptoms, what brought them to the doctor to begin with. Make sure that you do that physical assessment. And that physical assessment should include their height and weight, their vital signs, their general physical appearance, any evidence of hyper or hyposecretion can be identified during that physical exam. And when we talk about some of the disorders of the endocrine system, you're going to see where these physical conditions and these physical changes can trigger or can lead you to a hyper or a hypo situation. Make sure you visually inspect and gently palpate the neck for that thyroid enlargement. So remember, I'm sure that Ms. Howard covered that in physical assessment, that whenever you are palpating the thyroid, that you do it very gently, because an enlarged thyroid that's palpated too rigorously can actually throw a patient into what we call a thyroid crisis or a thyroid storm if you aggravate it too much. So make sure you use gentle palpation whenever you are assessing that thyroid. Now, some of the diagnostics that we're going to use whenever we're looking at these endocrine disorders are, your routine radiology. They're going to do CT scans. We're going to look MRIs. We're going to do those nuclear studies because we're going to be looking for a tumor that may be present, a tumor that may be having an impact on that gland that's causing that disorder. So we're going to be looking at those radiology tests. We may do some blood work as well. We're going to do some hormone focused blood work, like we can look at estrogen levels and progesterone levels. We can look at cortisol levels. We can also look at those thyroid panels, which include that TSH, which is your thyroid stimulating hormone. We can look at that T3 and T4, which are also thyroid hormones. We can look at that antidiuretic hormone. So there are a lot of different hormone related factors we can look at. Also, we can look at that blood count and the chemistry panel as well. So we're looking to see any electrolyte imbalances, and we're looking to see if there's any changes or any problems with that hemoglobin or that H&H or the platelets, whatever we're looking at. So we're going to do those blood chemistries as well. And as far as our nursing management, it's going to be focused on whatever the disorder is, because some needs, all the disorders are a little bit different, so they may be different needs for that particular client. But essentially, you're going to teach the patient about the purpose of the test. So they want to know what you're looking for. So we need to make sure that we know the purpose of the test so that we can relay that to the patient. The type of test they're going to have. Are they having an x-ray? Are they having some lab work? Do they have to be MPO for this procedure? Are they having some surgery to correct a disorder? Maybe to remove a tumor? Are there certain teachings we need to give related to that surgery that they're having? Make sure that you tell them how the test is going to be performed. Maybe they have to be sedated during a particular test. Maybe there may be a little bit of pain involved. So make sure that you educate them and tell them how that test is going to be performed. And of course, encourage any questions. You want to encourage the client to ask as many questions as they have. And don't be afraid to say, I really don't have the answer to that, but I'll find out. Walk out of the room, find the answer, and come back. Or have someone else come in who has an explanation to explain it to them. But you can always encourage those questions. And also offer some reassurance as well. So a lot of the endocrine disorders, some of them are kind of rare, or we see them more so than others. So just reassure the patient that they are getting the best treatment possible for their endocrine disorder. And we will begin with the disorders in the next video.